Hi, I'm Rob Blazer. Welcome to RPA's Public Policy in a Minute. The 2025 proposed payment rules came out in the last few weeks. These are all the rules that we care about. And of course, the most important one of those would be the Medicare fee schedule proposed rule, the way physicians get paid. And as expected, the conversion factor, which that's that multiplier by which physicians get a pay raise or a pay cut every year. As expected, it's projected for a 2.8% reduction for 2025. But this, of course, is with the expectation that Congress will provide some relief from that cut before the end of 2025. The valuation of services commonly provided by nephrologists, the RVUs, the relative value units, are expected to increase by about 1% for 2025. This is mostly on the practice expense side for what it's worth. And while most services provided by nephrologists have increases in value for 2025, the exception is the dialysis access services like 36901 through 36909. The reductions there are plus or minus 3% for all the codes in the family. Interestingly, CMS proposes to pay for some dental services for ESRD and dialysis patients, and there's been talk of this over the last couple of years, but this is the first time they actually put it in a regulation. Moving on to the ESRD prospective payment system, the way dialysis facilities get paid, the bundled rate for 2025 is proposed to be $273.20. This would be a 2.2% increase of $2.18 over the current rate of $271.02. Most significantly, this is a big deal. CMS proposes for the first time to pay for acute kidney injury services provided in the home as part of the bundle. We'll see how the policymaking plays out with that, but that is in there, and I would expect that's completely going to be in there in the final rule as well. And then finally, moving on to the ambulatory surgical center rule. This is where a lot of dialysis vascular access services get provided when they're not provided as an extension of physician practice. A 2.6% payment increase is proposed. So RPA will continue to track developments on all of these rules over the coming months, and we'll keep RPA membership posted on all key developments. And that's your RPA Public Policy in a Minute.